Hope everyone's doing well. Nice to see you all joining this morning.
Good morning, everyone, and welcome to the 2025 Kansas Early Childhood Government Summit. Governance Summit. My name is Cornelia Stevens, and I am the Executive Director of Top Early Learning Centers in Wichita, Kansas, but I also serve as the chair of the Kansas Early Childhood Recommendations Panel. This meeting is taking place of our February agenda for our meeting, and we are looking forward to learning more and hearing updates on all the wonderful things happening in the early childhood spectrum in Kansas. For our panel members, we'd like to thank you for serving our Kansas children and families and all of the early care and education professionals. Know that this meeting is being live streamed on the Kansas Children's Cabinet YouTube page, and the recordings of all presentation materials are available on the Kansas Children's Cabinet website if anybody's watching live stream or would like to see the materials as well. For today's agenda, we will have a welcome from Melissa Rooker, who is the Executive Director of the Kansas Children's Cabinet Trust Fund. We're going to have an early childhood legislative update from John Wilson with the Kansas Action for Children. Then we'll have part one of our governance group's presentations. We'll have a 10-minute break, and then we'll have part two. So we'll give you about 10 minutes to stretch, get some coffee or whatnot in between two portions of our presentation. And then we'll talk about next steps and closings. So first we are going to have Melissa, who is going to give a welcome and address to everyone. So Melissa Rooker, I will hand it over to you.
And Cornelia, I think maybe Melissa is not on yet, so I might jump ahead and then
Let's go
come
ahead and
back.
go to John. All right, so John, let's go on ahead and we'll give you opportunity to give a legislative update, and then we'll have Melissa do her welcome afterwards.
I love that. Everybody can hear me all right? Wonderful.
Yeah.
Okay, great. I just can't see myself, so if I look terrible, somebody let me know. Lindsay, if you want to go to the next slide, that would be great. Many of you all know that we are in the midst of a legislative session. Generally speaking, the legislative session runs from early January until May. This year is different. The legislative leadership has shortened the calendar quite a bit, actually. So the legislature is scheduled to wrap up on April 12th. And we actually just yesterday passed a key deadline. As a reminder, we have a bicameral legislature, meaning a House and Senate. So yesterday was really the deadline for bills that originated in the Senate to be voted out of the Senate and bills that originated in the House to be voted out of the House. Now, starting next Tuesday, the House can work Senate bills and the Senate can work House bills, and the regular, what they call standing committees, will be meeting between February 25th and March 18th. And then there's another key deadline where really all bills have to be passed out of one chamber or the other. And then we move into a time period of conference committees where the House and Senate work out the differences between versions of the bills. So at this point, there are many bills that were introduced to this session that are kind of dead for the remainder of the session. Depending on the committee that they were introduced in, they may still be available to be worked, but there are a lot of bills that are no longer workable this session and will just kind of hang around until January of 2026 when they can be taken up again. So that's kind of where we are in the session. If you talk to anybody who's spent any time in the building, it's felt very fast, especially when we think about the budget, which is really the one constitutional responsibility of the legislature is to pass a budget. And this year was a completely different budget process, which I'll touch on here shortly. But I want to focus in on the contents of what's happened so far as it relates to early childhood policies. And full disclosure, I understand lots of policies can interact with children and families, so it is hard to narrow these down, but I really try to focus on these things that are very specifically targeted towards early childhood. Starting first with Senate Bills 132 and House Bill 2294. They're the same bills, but one's a Senate version, one's a House version. This is the legislation that would consolidate multiple programs and services into a single state agency. It's a bill that had bipartisan support last year in the House, passing by over 100 votes. Right now, there is no hearing scheduled for those bills, but they are the special type of bills that can be worked for the remainder of the session and are exempt from some of those key deadlines. I wouldn't be shocked if we see hearings scheduled within the next week or so. So be prepared. If you care about the streamlining of programs and services into a single state agency and Office of Early Childhood, stay tuned to KAC for how to submit testimony and that sort of thing. And I would just say, I think on those bills, we're likely to see the House work the bill first and then kick it over to the Senate, similar to what happened last year. Then moving on to Senate Bill 207 and House Bill 2383. Again, identical bills. You'll often see identical bills introduced just to give you two paths to go down in case one chamber stalls, you have the bill available in another chamber. This bill was authored by Senator Titus and is another example of a bill that's exempt from these deadlines. So it's really great to have a couple of childcare and early learning focused bills that are exempt from these key deadlines. And this bill offers a package of essentially benefits and services to childcare providers to help offset the cost of providing care or of getting licensure, that sort of thing. So you can kind of see what it does there. That's a handful of things, a funding for a telehealth pilot or expansion of existing telehealth services, stipends for prescription drugs, funding to make up the difference between Tier 1 and Tier 2 for the CACFP program, and a few other items. Right now, no hearing is scheduled, and what's interesting is this is a policy bill, but the policies in it do require funding, and so far in the appropriations process, specific funding hasn't been identified for that. So if those bills move forward as standalone bills, there will have to be what they call a trailer bill or a reconciliation bill that essentially takes all the fiscal notes from all the policy bills and puts it together into a mini budget bill to say we're gonna fund these things. Otherwise, they become kind of unfunded mandates. All right, let's move on to the next slide. House Bill 2210 would establish a state child tax credit for ages 0 to 3. This is an issue that's very important to Kansas Action for Children, and it's also an issue that we've seen bipartisan support for at the federal level and actually at the state level last year through an amendment in the Senate. A child tax credit essentially provides a cash benefit to families on a per child basis, and the way that these tax credit bills are structured are to provide higher benefits to families living on lower wages. But every family with children would be eligible. Just the higher amount of income you have, the smaller the credit. So House Bill 2210 is for children ages 0 to 3. For Senate Bill 179, it's 0 to 5. So the key difference there would just be a higher fiscal note, meaning cost, for Senate Bill 179. House Bill 2119 passed the House this week, 85 to 36, and it eliminates the affordable housing tax credit, which has been used to build affordable housing. So developers would apply for these credits to help lower the cost of building housing for families that need more affordable options. The credit has been utilized so much that it was the cost keep going up every year for the amount that we're spending on the credit, and so certain lawmakers had concerns with that. But why that's an early childhood issue is obviously if children don't have access to safe, stable housing, then that negatively impacts their development. And so not sure what they're going to try to replace it with or whether this will ultimately get through the finish line, but it's something to pay attention to, especially considering that there were nearly 40 opponents to the bill and no formal proponents of the bill. HB 2074, that was an effort to include renters in an existing property tax credit program because an increasing number of Kansans are renters. And so, again, one of those things to provide safe, stable housing for Kansans. Let's move to the next slide. We'll focus on health issues. 2386 and then 271 would update eligibility for the Children's Health Insurance Program. Kansas has this error in statute that really links our eligibility for CHIP to 2008 poverty levels. And obviously, as inflation continues to rise, that chips away at the children who are eligible for this really important health insurance program. So these bills would provide a permanent fix to that technical error that exists in statute. There are also budget provisos, which I like to think of as little sticky notes on the budget that are mini pieces of law that only last for a year. There are budget provisos that fix it for the upcoming budget year that begins July 1, but we would like a permanent fix to that. And then Senate Bill 79 passed the Senate 29 to 11. It disallows SNAP recipients from purchasing candy and soda with their SNAP benefits. Fairly controversial bill in the legislature and actually taking up a surprising amount of time and energy. And it's a bill that I think creates tension among anti-poverty advocates who are concerned about the continued just kind of punishing of people who are living on low wages, and then health advocates who think we need to be doing more to improve the health of Kansas residents. So stay tuned on what happens to that. I will say that that policy was essentially included in the budget that was passed by the House in what I think is a bit of a extortionary kind of maneuver where the House Appropriations Committee agreed to fund a summer food program, the summer EBT program that provides benefits to children, to families with children to buy food during the summer. They linked the funding for that program to the state applying for the waiver, allowing them to not allow soda and candy purchases with SNAP. So that was a really disheartening move that we saw in the Appropriations Committee. All right, Lindsay, next slide. Last one is what is the budget bill right now? As I mentioned at the beginning of my comments, this year the budget has been moving very swiftly, and it's a completely different process. Beginning late in the fall last year, between Thanksgiving and the winter holidays, lawmakers met in special budget committees to begin crafting their own budget. And that's what they started with in January when they came back in session. Typically what happens is the governor proposes a budget that is informed by all the state agencies that are within the executive branch. That didn't happen this year. They essentially pushed the governor's recommended budget to the side, started with their own budget, and the result is pretty disappointing. So the things to know is, yes, there was funding for summer EBT, but again, it was linked to a policy that does not have the support of everybody in the legislature, and so really disappointed by that. Also, it doesn't include full funding for special education, reduced it down to $10 million additional money for special education. There's some good things like slightly increases the dental benefits and pediatric sick visits for the Medicaid program, which is good. But it's not as high as advocates were looking for. The budget also lapses funding for about 1,000 state agency positions. There's a blanket 1.5% cut made across all agency operations. And that actually came about with about less than 2 minutes of discussion on that amendment to do that in committee. There's $1 million allocated for an efficiency analysis that will look very similar to the types of things that we see at the federal level, where it's kind of using AI technology to try to root out inefficiencies. There is, let's see, and then there were some funding changes made to the Children's Initiative Fund where the workforce registry and child care health and safety grants were the chair moved that the CIF funding for these line items would be eliminated, but that the agencies could find the funding within their current budgets to pay for those. So in all, the budget is significantly less funding than the prior fiscal year, does not kind of begin to touch some of the needs that we know exist across the state as it relates to early care and education. We're only working now with what the House has done with the budget. What's up next, though, is that this bill 2007 goes over to the Senate Ways and Means Committee, and they have the opportunity to add or amend things. But what's important to know is the best place to get things added for funding is in committee, because once a budget hits the chamber floors, they have to the chambers have a rule in place called pay-go. And pay-go means you can't add new funding without finding a new source of funding for it. And so when you already start with a lean budget, as we did on the House side, that means it's very difficult to add things on the floor. So if there are funding priorities that are important to you, that are important to kids and families, your target is now the Senate Ways and Means Committee within that time period I just mentioned, between starting next Tuesday until they would work at the week of March 18th or so. I'd be happy to answer any questions. I know this is a lot to throw at you. It's a lot thrown at us who are in the State House. I don't know if we can do questions. I don't know if this is allowed.
Yes, questions are allowed and encouraged. So does anybody, first off, John, thank you for that update. And thank you for all of the work that you're doing. I know this has been a busy, different, but the busy session. Do we have anybody that has questions for John? Amy?
Sorry. Thank you, John. This is Amy Gottschammer. So just so if I'm understanding this correctly, that we can just address any emails or communications to any of the members of the Senate Ways and Means Committee for any of these that are passing over to the Senate side. Is that what your recommendation is? Do I understand that?
Yeah, my recommendation is to find a champion or two on the Senate Ways and Means Committee. And I did put the link to the Ways and Means Committee profile page on the legislative website in the chat box. And again, what's nice, when you go to that page, you'll see the chair, vice chair, and ranking member. And as a reminder, the chair and vice chair are Republicans. The ranking member is a Democrat. And then the remaining members are proportionate to the partisan makeup of the legislature. So you'll see far more Republicans than Democrats. And there are instructions for how to submit testimony when the opportunity arises, but I'm not yet sure how Senate Ways and Means is going to handle testimony and public input on the budget. But typically what we've seen is either subcommittees of the Senate Ways and Means Committee meet, like a few members of the committee meet separately to look at various budgets, the DCF budget, the KDHE budget, the KSDE budget. Not sure how it's going to work moving forward, but we have a newsletter that folks can subscribe to follow along with legislative activity.
Very good. Thank you so much.
You bet.
Any other questions? Okay, if none, John, thank you again for this presentation. If you don't already subscribe to the Kansas Action for Children newsletter, please do so. They give you amazing news blasts every week, or more often if needed, just so that we are up to date of what's going on, give you a kind of direction, if there's anything that we need to advocate for. And so, John, we look forward to any alerts or information that you have to share. And thank you again for advocating and supporting our Kansas children and families.
It's my pleasure. Thank you all. And it takes all of us doing our work from our parts of the state.
Absolutely. Absolutely. Before we begin our governance group presentations, I would like to turn it over to Melissa Rooker, who is going to give a welcome.
Thank you, Cornelia, and apologies for being late. I had a lawmaker call me just as we were needing to log into this meeting. So I appreciate the work that goes on throughout the year in all of the different spaces that we'll hear about today. I think it really is all of us that contribute to the vision that we laid out collectively in the All In for Kansas Kids strategic plan. So we appreciate the chance to get together every year with and just hear updates and progress from all of the groups hard at work across the state. So I just want to let you know that I know these have been stressful times in a lot of different sectors based on just events federally in the last month. We're dealing with it. I'm reading a directive from the U.S. Department of Health and Human Services issued, I think, yesterday that deals with basically the terminology they use is protecting children from chemical and surgical mutilation. So it is the assault on transgender care that as a recipient of HHS funds, we are being notified is now a thing that exists. The same thing happened to us a few weeks ago with the executive orders basically banning diversity, equity, and inclusion efforts. We know the federal government is using AI to look for words in things, in places that trigger a response. So we've seen really difficult orders to stop funding a program that helps high school students on an IEP transition out of high school into the workforce because the program has transition in the name. We've seen similar things in odd places. The IRS, you can't have I think it was diversity of funds that would be reported in one place. So suddenly those rules are gone. I share this because I think it's just a note of caution that as you are engaged in all of the good work that's happening, being mindful that it's a really superficial effort that deals with word choices. Do with that knowledge what you will, but I am really protective of the work we do and the importance of what we deliver for the well-being of children and families across the state. So just share that and as food for thought. Cornelia, we've appreciated your leadership on the panel through the last several years and are grateful to everyone who volunteers their time to serve on the panel, and Lindsay keeping things in motion for all of us, keeping us on the right track. So I just want to say thank you for all of that effort, and I will turn it back over to you to carry on the rest of the meeting agenda.
Thank you, Melissa, for the welcome and for all the work that you do with the Kansas Children's Cabinet. This is, I appreciate hearing you say that you protect the work that we do, because it's important, right? And so we value and appreciate your leadership. So as I mentioned earlier when we began, this meeting is actually taking place of the Early Childhood Recommendations panel meeting. So for the first governance group or a group presentation, we'll go on ahead and have an overview of what the Early Childhood Recommendations Panel actually is. So Kansas Executive Order 20-02 designates the Kansas Children's Cabinet and Trust Fund as the State Advisory Council on Early Childhood Education and Care. The panel is an advisory group to the Children's Cabinet to support these responsibilities. Our meetings are on the third Friday from 9 to 11:30, and they are live streamed on the Kansas Children's Cabinet YouTube channel. Anybody that is interested in submitting comments to the panel can actually submit a open forum comment form, which is on the Kansas Children's Cabinet website, and you can either present in person and or in writing. And we are really encouraging anyone that has anything they'd like us to hear, that they'd like us to know, thoughts about anything that's going on. So anybody that's watching on the live stream, definitely we encourage you to present information if you'd like to share. All of the meeting materials are posted on the Kansas Children's Cabinet's website at kschildrenscabinet.org/panel-meetings. The Children's Cabinet appoints members annually to a one-year term that begins July 1st and ends June 30th. The call for membership applications is shared in April. Currently, there are 42 panel members representing state agencies, local school districts, higher education, local early childhood care and education professionals, Head Start, parents of young children receiving services in Kansas, and organizations providing early childhood services. Next slide. Panel work groups continue their efforts in terms of our accomplishments or whatnot. We continued efforts to implement the strategies from our early childhood strategic plan. Family-friendly workplaces gave a recommendation that was approved by the Children's Cabinet in August of 2024. So some of the things that happen in our work groups can actually result in recommendations that are given to the cabinet on things that may actually benefit Kansas children and families. Some may just be ideas or things to think about. Some may be just opportunities for us to have maybe a deeper dive into issues or things that are going on so that there's thoughtful decisions that are being made and we can share that information with those the decision makers. But our family-friendly workplace group actually did result in a recommendation that went to the Children's Cabinet in August. Throughout the year, panel members welcomed presenters from a broad cross-selection of early childhood programs across the state. We had people from the Kansas Casino, the Kansas Child Care Training Opportunities, the Kansas Department of Education, KU Center for Public Partnership and Research, Kansas Breastfeeding Coalition, Kansas Department for Health and Environment, Kansas Action for Children, and the Office of Rural Prosperity. And so we really have a diverse group of people who have come and presented to us and are, again, encourage anyone that would like to come and share information or present to the panel. So if you have any work group or anything like that that you're doing, we would love to open the opportunity for you to speak. Representatives from state agencies, organizations, and community partners from the Kansas Early Childhood Governance System met February 16th, 2024 for the third annual summit. And now here we are this year for our fourth. And reporting on how all of the work that we're doing really aligns with the All In for Kansas strategic plan. Next slide. We have several work groups that are in place right now for the recommendations panel. We have family-friendly workplaces. That work group actually is establishing a family-friendly workplace designation and promoting its importance and utility through effective marketing strategies. An exit interviews work group, which is assessing current Kansas early childhood ecosystem practices to identify effective strategies for understanding the challenges faced by professionals that are leaving the field. And this is really for all early childhood programs, not just necessarily in childcare, but we really want to understand, like, what are the reasons people are leaving? And so we're trying to come up with a unified system to be able to, but simple system to be able to identify those challenges so we can maybe come up with solutions to help with that. We have our mental health support work group. This is a workforce mental health support group, and that's developing a list of free mental health resources available to the Kansas early childhood workforce and analyzing workforce survey data to uncover key insights to better support the mental health needs of early childhood professionals. We have a targeted journey recruitment work group, which is examining targeted recruitment strategies to expand the early childhood workforce. So as we have people who are exiting the field, how do we do more to target, and what more can we do in Kansas to be able to bring people into the amazing work that we're doing? And then the systems progress communication work group, which is assessing how to help members and communities stay informed about ongoing early childhood ecosystem work, learn from local solutions, and apply those lessons broadly. Next slide. As was mentioned, my name again is Cornelia Stevens. I am the chair of the Early Childhood Recommendations Panel. My contact information is here. Miss Lindsay is our amazing person who basically coordinates everything that has to do with this work group. And so if you have questions, comments, or anything like that, her contact information as well. So take a screenshot of that so you know how to reach both of us. So with that, do panel members have any questions? I guess we're supposed to give questions about anything between groups. Does anybody have questions about any of the work that we're doing? If not, we're going to turn it over to our first presenter. And the first presenter that we have is going to be Chelsea Schulte, who is going to give an update on the Workforce Development Advisory Group.
Hello, can you hear me okay?
Yes, ma'am.
Great. Yes, my name is Chelsea Schulte. I am Associate Director of Programs at Casito, and part of my role is facilitating the Workforce Development Advisory Group. If you want to go ahead to the next slide, there we go. So the Workforce Development Advisory Group is part of the childcare workforce professional development contract that is funded through DCF. Casito currently holds that contract. So we pulled together a diverse group of people, really with the focus on gathering feedback and input and ideas from direct service professionals as well as partners within the PD system, with a focus on improving the PD system. So as Cornelia presented, there are lots of similarities, I would say, in the structures of what the recommendations panel does and what the Workforce Development Advisory Group does. So I think it's important to call out really the focus of the Workforce Development Advisory Group being on really, I would say probably more narrow when we talk about like the early childhood workforce, that this is a little bit more focused on the childcare sector of the early childhood workforce. Though we know that these things intertwine and you can't really just look at it in a silo. And then also looking specifically at the PD system for the childcare sector of the system. And really focused on gathering the feedback to inform those. So we also, like, as Cornelia mentioned, for the recommendations panel, we've got a wide group of representation on our group. It is not something, it's not like an application. We've got a live link on the Casito website where if you're interested in joining us, we would welcome you. If you sign up, there are several work groups, which I'll talk about on the next slide, but you can sign up to get involved in those if that's where your heart leads you. There's lots of great work happening there. And so we have some folks that just attend our work groups and some folks that engage in just a large group and some that do both. So happy to have you if you've got some input on the PD system. Next slide. So as I mentioned, most of our work is happening in work groups. Our large group meets every other month for an hour and a half. So all of the good work is really happening in between those meetings where we talk about a topic at a meeting and then we charge our membership to go out and gather the feedback to come back to the next meeting and say, what are you hearing in the field? What are the concerns? What are the ideas? How do we move forward? And oftentimes that comes with the development then of a work group or the assignment maybe of this topic to a work group. On the screen there, you can see our current active work groups. Our equity, inclusion, and diversity work group is, excuse me, their goal is really to focus on reviewing, discussing, and disseminating resources around the topics of equity, inclusion, and diversity for the greater good of the PD system. Our core competencies work groups, I'm confident you are all aware that that Kansas has adopted new core competencies within the last year. So having those out and published, and that was a major lift on that work group. But just because they're out doesn't mean that work group dissolved. They are still working very hard to make sure that folks are supported in using those core competencies. That was a big piece prior to the adoption of the new ones. There was not a lot of awareness around our old core competencies. So that group is really focused on how do we support everybody in the system in adopting and using and understanding these core competencies. The individualized professional development plans, or IPDPs, that work group, like core comps, last year rolled out the new IPDP with a self-assessment based on the core competencies, so some overlap there. Have all of that information available in English and in Spanish, so it's really exciting. And right now, their work is really focused on how it gets integrated into CAPE, the new workforce registry, so that people can build and create IPDPs for themselves within CAPE, and then thinking through all of the cool things technology could do for us in terms of like, right, you fill out an IPDP and maybe it says, you might want to take this course. So really dreaming big about what technology can offer us in terms of supporting the workforce in growth. Evaluation and needs assessment, that group has historically been really focused on making sure we do a needs assessment annually to gather feedback from the field. We are right now in a period where we're trying to gather feedback more organically, and also continuing to glean insights from the massive comprehensive workforce study that was completed last fiscal year. So lots of information still to pull out there. And if anybody is needing information from that survey, I welcome you to reach out to me and I can get you connected with the people that have that. Lots of great information there that's been informing all of the work that we do at the Workforce Development Advisory Group. But the other piece that they are looking at right now is like statewide training evaluations, so that regardless of who you take training with, you would answer the same evaluation questions to allow us to look at training evaluation more comprehensively statewide. And then there are plans to look at that for technical assistance as well. So evaluation on coaching or consultation. Collaborative TA Network is working on really just building a framework for technical assistance. So establishing shared definitions. So we're all calling the same thing coaching or the same thing consultation, that we all kind of understand those things the same way. With those shared definitions being then kind of a framework or a foundation then to be able to build out like a reporting system in CAPE and to be able to make referrals within CAPE. And then lastly, trainer and training approval. These have been very active in the sense that they are currently being built or finalized perhaps within in CAPE for a future launch. So we're really excited about that. It is kind of in a hybrid or bridged approach right now between when KDHE stopped doing the training approvals and when CAPE will be effective to handle that. So we've got a bit of a bridge there in the middle, still supporting the approvals, but continuing to work toward a collaborative, functional, technical system within CAPE. So I think the overarching idea here is that a lot of our work is being informed by the results of the comprehensive study and the feedback that we're getting from the field and from partners. And CAPE, which I guess we could go to the next slide, is that CAPE has become a tool for all of us in the system, but it has really helped to like conceptualize this being a system. And it's really highlighted the importance of coming together to make shared decisions, right? That we can't all use different TA definitions if we are all going to use the same reporting system, right? So finding the commonalities and really digging in and looking at what other states are doing and how we can make this system work best for us and efficient for us so that we spend less time doing like the reporting and gathering of information and more time like doing the good work that we all want to be doing out in the field. So we will continue to use the data and the feedback to make recommendations. To Cornelia's point about the recommendations panel, sometimes we take those recommendations up to the recommendations panel to take to the cabinet. With the new CAPE governance system, it's possible some of our recommendations will go to CAPE if we're requesting something new there. Otherwise, sometimes they are just general, like, hey, to the field, this is something we should consider and collectively move forward. So if you have thoughts about the PD system for the early childhood sector, let me know. We'd love to get you involved in the Workforce Development Advisory Group. Oh, and then that's me, Chelsea Schulte. You can sure reach out. That's all I've got.
Thank you very much for the update, Chelsea. As you said, lots of alignment, right, in the work that is happening here. So does anybody have any questions for Chelsea? Okay, if none, thank you again. And there's her contact information, screenshot that if you need to, just in case you'd like to reach out to her. Next, we will hear an update from the Child Care Systems Improvement Team, and we'll hear from Melissa Schoenberger.
Thank you, Cornelia. As you shared, I am Melissa Schoenberger. I am the Director for Childcare Licensing that focuses in on our systems and our field services. Our other co-director is actually a part of the panel, Jarvis Dolman, so I have to give a shout out to our co-director. Wanted to thank you guys for having this opportunity to invite us to share a little bit about what has been happening with our systems improvement team. Our systems improvement team is a group of stakeholders who apply for a 2-year cycle to really dig down deep and the nitty-gritty with childcare licensing to really help us evolve as a program. What I really appreciate about our systems improvement team is their transparency and honesty within our group to say, hey, you guys are really hitting the target, or here, this is where I see that we can improve. And our systems improvement team is truly a makeup of the child care licensing program throughout the state. I remember many, many moons ago when I first started with child care licensing at KDHE, you really had to live within the Topeka area to be a part of the systems improvement team. And with our virtual ability, we have been able to garner support and stakeholders from all sectors of the state, including our really ensuring that we have folks and representation from our frontier counties, because childcare is an issue in all sectors of Kansas and not just one isolated area. So, Lindsay, if you want to move to the next slide. What are we doing this year? Last year, we were fast and furiously really utilizing our systems improvement team to provide us feedback within our regulation review. And then once we our regulations became effective, our new regulations became effective August 2nd, we took a breather and thought, really, what is our next where can we utilize our systems improvement team to really activate the childcare licensing ecosystem, and not just the childcare licensing ecosystem, but really in general the early childhood landscape in Kansas. And so we decided we really needed to get vulnerable in our communities. We really enjoyed the feedback we received in the regulation review and decided to go out into our communities and really engage stakeholders, wanted to engage consumers, which are our families and guardians, because every family in Kansas looks different, and then really wanted to engage partners. And in a really low-tech environment, just really having conversations of what are we doing well? where are improvement and where can, the state in general, because again, we didn't want to bring folks to the table and just have it be about childcare licensing. So we are listening to all feedback and then doling them out to our partners as need to. And our next one is coming up. This one was in March. It will be in Wichita, March 12th. It feels like it's such a long time ago but it's really just a couple weeks. March seems really far away, and I'm hoping for 50-degree weather and no snow, and that we can have a robust turnout. But so far, we've met in Abilene and we've met in Topeka. And what we really have been excited is we're looking at locations that consumers and partners feel comfortable with. In Abilene, we were hosted by a child care center, which was just really kind of fun because you got to go look at really in the environments where children are being served. In Topeka, we went to the Shawnee County Health Department, which is such a critical component into a community. And in March, we will be hosted by our resource and referral partners with Child Starts. So really hope you can come. The registration is really easy. And again, everybody is welcome. And if you don't register, just show up. Pre-registration is encouraged, but it is not necessary for you to be a part of the roundtable discussion. And again, events are open to the public. If we can go to the next slide. As I shared, we're really wanting to look at what we do well. And some of the early feedback that we have had during the roundtable discussions that, again, may not be a part of our system, but supports all of the system and really taking a tag team effort with Chelsea's group and the workforce development is mentoring has been a real common discussion point of providers going outside of traditional systems and creating their own mentoring network. And so really wanting to tug on that with our partners as we get to the end of our roundtable system of what are we missing and how do we plug and support some of those more organic natural environments that have nothing to do with any of the traditional systems and funnels in the state of Kansas, and how do we go to them and versus us expecting them to come to us as statewide agencies. So really love seeing some of those, again, organic mentoring systems. And then some of the needs that we have heard is just the provider help with technology and our technical systems. And in the state, in the state of Kansas, childcare licensing itself is looking at launching a new provider portal and our new system of how we do our surveys and how people interact with KDHE when they're applying for a license. So hearing very early on that we need tech training really then puts a bug into how do we, when we launch our system, do better. And the same as we are a partner with CAPE, with the workforce registry, and how do we get that information when providers might be struggling, because we're really excited about these online systems and technology, but we need to make sure we're not leaving anybody behind because of the new technology. And what do we need to do to really help everybody? And we're working to share progress back. And one of the things that I, just really want to share that was beneficial of our roundtables is in Abilene, we have seen, we saw come to the table a lot of school district staff and really saying, how do we get childcare programs into our school districts? They were discussing it as a recruitment and retention for teachers. And then also just as a point of where we might have students who need childcare and really looking at but we don't want to, we don't want to steal from the community. We want to be in another layer versus a competition. And so love those really early conversations. And what they were not aware of is that they have really helped push forward a plan that KDHE was already working with the Department of Education. And in March, on March 12th, again, March 12th is just a really great day. I think the sun must be aligning and we have like the perfect moon, everything. But March 12th, the All In for Kansas Kids will be hosting the Department of Health and Environment, specifically the Child Care Licensing Program in the Department of Education. And we will be having over the noon session a roundtable discussion really pointed and specific to challenges within the school districts. And we're not going to be leading the discussion because nobody wants to listen to me or Natalie, or, I see Natalie's on here, or Amanda Peterson. They want to listen to the folks who are doing the work. And so we have really put together a great, strong panel of school districts and childcare staff within those programs who will be discussing successes and pitfalls of their journey through that. And so I'm going to put a plug because it really does align with the systems improvement team work and where we want to go and how responsive we want to be in a real time when we hear that there are issues. And then we can get together with our partners and say, well, let's put a panel together. Let's figure this out. Let's have really good, robust discussion, and appreciate our partners at the Department of Education and the Office of the State Fire Marshal and the food program, and all of our people who are living and breathing the work, who will be together. But we wouldn't have been able to move that together so quickly if we did not have the support of our systems improvement team and those really candid discussions of the roundtables. So again, wanted to illustrate that we're not going to just wait for the end of the roundtables to happen over this next year, but we really want to have those conversations as they happen organically. Lindsay, if you can move on to the next slide. And then the other piece that we're going to be moving forward within our systems improvement team and with our own contractors is looking at our licensing specialist core competencies. The core competencies of a licensing specialist, otherwise known as our surveyors. We rebranded over the last year to really align what our licensing specialist does as more than just somebody with a pen and going in and check marking what's wrong with the facility, but they're there to support, provide technical assistance, and really be that front-facing local expert from the very onset of somebody who's exploring childcare. And we want to make sure that we have competencies that align with the work. And our competencies will be looking at knowledge, skills, and abilities and expected behaviors. And we really want our systems improvement team to have a voice because they represent a variety of sector that interacts with our licensing specialists, whether it's at the resource and referral, the communities in action, somebody getting a referral to an infant toddler specialist. They all interact in a different manner with our licensing specialists. And we don't want to, I personally don't want to shortchange our licensing specialists when we're looking at their knowledge and expected behaviors, and really want the full system to have a voice. And most importantly, we have providers and on our systems improvement team. So they will have an opportunity to have a voice. And we have licensing specialists on our team. So it's, again, an opportunity and a place to be vulnerable and make sure that we are right sizing what the expectations are for our licensing specialists and that we're very transparent when we say this is what our licensing specialist represents front facing with our program. And that will be taking place next week. We are going to be meeting with our systems improvement team, and then we have a tail end meeting with our licensing specialist too to go over the same exercise. And looking forward to the feedback. So we're a busy team, but I think we are a team that is evolving and pushing forward ideas that fit the needs of the early childhood landscape in the state of Kansas. And again, here is my contact information. I am an open door and appreciate anybody calling or emailing, and looking forward if you have any questions or if you are excited and would like to be a part of the systems improvement team. We're always looking for movers and shakers that want to be a part of our really groundbreaking work moving forward. So please reach out. And if there's any questions, I would be willing to take them at this time.
Thank you, Melissa. So again, opportunity for anybody to ask questions.
Yeah. If not, feel free to email me later.
Okay, thank you for the update.
Thank you.
Next, we will hear from Kayla Byers and Megan Chizik, who is going to be giving an update on the Family First Prevention Services.
Wonderful. Thank you so much. I'm Kayla Byers, and I'm here with Megan Chizik from the KU Center for Public Partnerships and Research. And we're representing the Kansas Interagency and Community Advisory Board and the Family First Family Council that oversee the Family First Prevention Services for Kansas. So just a little stage setting about Family First Prevention Services. So these are services in the community intended to shift the focus of child welfare upstream to keep children and families safe together and avoid entry into foster care. So this is a repurposing of Title IV dollars for community-based upstream services. And those services are those dollars are supporting services in mental health, substance use treatment, in-home parent skill building, and kinship navigation. And those are an array of services that are approved by the federal government and based on their evidence base. Next slide, please. Thank you. Just also a little bit of an overview of how Family First oversight takes place. So there are 3 levels of oversight for these services. So at the state level, DCF oversees these services according to our 5-year prevention plan that's approved by the Children's Bureau. And then it's also driven by the statewide vision for thriving families, which is really about building capacity for prevention in the state. At the community level, the Interagency and Community Advisory Board, which is made up of state agency representatives, community providers, and also representatives of our Family Council, which is 21 members with lived expertise with child welfare and or prevention services who are a standing body and advise DCF and others around the prevention landscape in Kansas. Next slide. So just a little bit of overview of the impact that we've seen through the evaluation of these programs. You can see here, there have been more than 6,600 families referred to Family First Services since they were instituted in 2019, which is a great reach across the entire state. Every county of the state has Family First Services in place. And through the evaluation, we've been able to understand the effectiveness of these programs as a whole in terms of promoting well-being for children and families and preventing that removal to foster care. So among families who have completed Family First Services across that whole array of mental health, family skill building, and home services, et cetera, we have seen that families who complete those services have had significant improvements in child social emotional functioning, in caregiver mental health, so that's in anxiety, depression, and stress, caregiver perception of their own parenting skill, and then also substance use. So all of those have shown improvement that are significant over time. We also see that permanency in 1 year, so families staying together safely in the home after 1 year after the referral, families who receive Family First services are 51% more likely than families receiving other prevention services to stay together in the home. And what that means, and the way that we are interpreting that, is not that other prevention services don't work. It's that these services are in the community. They are further upstream. They are reaching families earlier in their need cycle and hopefully resolving those crises before they escalate into the need for further intervention. So if we're catching families earlier on, we're seeing a greater likelihood that they'll stay safely together in their home without the need for child welfare involvement. And what we see are, among these 6,600 families who've been referred, 90% of the families who receive Family First programs do remain safely together in their home 1 year after referral. So thinking a little bit about some of the system impacts of this work. So through the Interagency and Community Advisory Board and the Family First Family Council, we've been able to monitor Family First implementation. So that's happened through a continuous review of the lessons that we're learning, of the outcomes that we're seeing from these programs. And these are brought to the ICAB, the Advisory Board, and the Family Council. And recommendations related to the service array, related to access and system support, emerge from those reviews. We do rapid cycle feedback loops to help support that accountability. So when recommendations are made, we learn what happened and are able to then continue to iterate and make further recommendations to strengthen systems and services. And one example of that is in the last year, the Family Council was invited by DCF to partner in terms of drafting a new vision for the renewal of the Title IV Prevention Plan, which guides the Family First services across the state. So that we've had a plan approved for the last 5 years. It's time for renewal. So the Family First Family Council drafted a vision for the renewal that included recommendations that were emergent from these multiple years of review of the data, monitoring the implementation. What are we seeing from families and providers in terms of the impact of this work? And they put forward several recommendations that are planned for phased integration through modification to the state plan over time as we were able to build the capacity to support those recommendations. So that included the addition of new services that are peer support services, a major recommendation from the Family Council. Also other pathways to access the Family First services that are more community-based and community access points. So there are a couple of recommendations that have emerged that from these bodies that DCF is taking up and exploring how to implement and with plans for phasing those in as we move forward. I'll turn it to Megan to talk a little bit about our additional efforts and future plans.
So earlier this year, actually in 2024, we restructured the ICAB, the advisory board, and wanted to align it and kind of bring together our visions across the state around our Thriving Families effort. So really Thriving Families is a framework that really drives the philosophy of proactive approaches to families, ensuring that they get services when they want and need them, instead of kind of waiting for a crisis to happen. Or if a crisis happens, there is a service right away. And so Thriving Families is really intended to shift from reactive to proactive, promoting the well-being of children and families. And so we restructured the Interagency and Community Advisory Board to kind of being the working arm of our Thriving Families efforts. So there are a lot of ideas and priorities set forth through the Thriving Families vision, both in Kansas and nationally, as Kansas is part of this national movement. And the ICAB helps carry out those priorities through a number of priorities, which we'll talk about, some action steps that they have identified and recommendations. But this is really, the intention here was to reorganize the structure to have regional champions across sectors. So you can see here we've listed early childhood, behavioral health, education. It hits a number of areas across the state because we know that prevention and well-being is does not live in a single space, that it crosses all sectors. So it's not just early childhood or just child welfare. It's all of these things working together to ensure families have what they want. And then our ICAB is made up of our Family Council members, which is 21 members with lived expertise of the child welfare system in some capacity. And they're really pivotal to ensuring that the work that is happening is being driven and co-designed by people who have experienced the system themselves. And then key statewide decision makers from our state agencies and across the state. And the recommendations, the way we've sort of restructured this is that we have built sort of a rapid cycle and closed loop process. So recommendations are elevated by the ICAB and the Family Council. They're sent to the respective entities such as DCF or other state agencies, and then system changes are then reported back through a rapid cycle accountability process. So that things don't just get recommended and sent into the ether, but there are opportunities for everyone to, I just got spotlighted, for everyone to understand kind of where those recommendations live in that process. So we want to make sure people feel like there is a partnership in recommendations for change and for new opportunities across the state. Next slide. So as I mentioned, the ICAB and the Family Council are working on a number of action steps around the priorities set forth by both Thriving Families and their own entities as they drive their work. So the ICAB currently is working on a policy review of barriers to hiring lived experts. So this is a key part of our Thriving Families efforts in ICAB and across the state. We recognize that the voice of lived experts is critical to success of any initiative, and we have really grown in that area. And one of the identified barriers we found is that hiring formal employment of lived experts is often a challenge in some spaces due to history of perhaps child maltreatment in the past or a criminal record, and doesn't matter how long ago those things were, it still continues to be a challenge. And also just the compensation that is part of kind of the expectation of working with lived experts, that we are honoring their expertise and their time just as any other professional. The ICAB is also working on increasing awareness about family support among mandated reporter groups. So we know that there's a bill right now in the Kansas legislature looking at redefining neglect in statute. So really trying to differentiate neglect from poverty. And so when there is a concern about a family that is not a safety concern, it is a concern of access to services or needs that look maybe like neglect, but are actually financial related. We want to make sure folks know where to turn to get families connected to the support they need. And then third, they are looking at additional prevention models. So peer support, supporting caregivers, a variety of other prevention support models that could be added to the prevention array in the prevention plan. And then finally, the Family Council is doing a number of things, but among those, they are advising DCF on prevention programming and policy to enhance access to resources and support. So they're looking at what is needed. They are recommending the necessary services and supports that could be added to the prevention plan. And also they have been integrated into the policy review process. So in the workflow, DCF PPS is looking at their policy process. They might make a change or add a new policy. That policy is brought to the Family Council for them to weigh in and to provide their feedback and suggestions on what that policy's impact might be and how they could improve it and ensure that it is in support of children and families. And then they are also working on developing tools and resources to support family service access and navigation. So they're looking at existing things like 1-800-CHILDREN and closed loop referral programs like IRIS and Unite Us to figure out like what is out there that families, how can they get connected to the services they need and ensure that they know where to go when they have when they have a concern or a question. I think the next slide just has our information, so you're welcome to ask questions or certainly to reach out to us anytime. you.
Thanks.
Thank you, Kayla and Megan, for the updates. Does anybody have any questions at all? Okay, if none, their contact information is there on the screen. So again, screenshot it in case you would like to reach out to them in the future. Next, we will hear from Jennifer Miller, who is going to give an update on the Kansas Maternal Child Health Council.
Good morning, everyone. Thank you for having me today. I'm excited to share with you about what our Maternal and Child Health Council is doing. I'm Jennifer Miller, and I'm the Title V Maternal and Child Health Director at KDHE. So the purpose of our council really is to serve as an advisory board to the Secretary of Health and Environment. We want to really work with a diverse group of partners to identify ways that we can promote health of the maternal and child health population across Kansas. And so we do that with really partnering with a lot of different individuals that are working in this space so that we're aware of what's occurring in those communities and really strive to come together on what is the best way for us to move forward in advancing health in Kansas. Next slide. So we spend most of our meetings really encouraging the exchange of information about what's happening with women, infants, and children, as well as adolescents in this state. This includes hearing from partners. We've recently started doing some partner spotlights at the start of each meeting so that folks can really share who they are and what the work they're doing, so that the entire council is really aware. We also use this council to help advise not only the secretary on those broad maternal and child health population needs, but also on the needs as they relate to our Title V block grant and the application that we turn in every year for that funding. We also use this as an opportunity to really create that private public sector support. So we try and have a variety of partners, those working within, whether it be an FQHC or working within part of the state government or county government, and get those diverse voices so that we know what each different sector is facing, so that as we make our plans as Title V, as well as KDHE, maternal child health, we're really focusing in on the broad picture and not just those specific things that we're hearing from people that we traditionally partner with. And then lastly, we do submit a report to the secretary every year. This report also goes to our federal partners at the Maternal and Child Health Bureau every year as part of our Title V block grant application. Next slide. So over the last year, we have used our time to provide a lot of different information to our partners, as well as hear from them. So we've talked about things from home visiting initiatives to some diversity, equity, and inclusion work based on the governor's racial equity and justice report that was released, and what the maternal child health programs have been able to integrate, and what is that we still need to, and really seek some ideas and support around how better to do that. We also have looked at the palliative care plan and how that impacts our maternal and child health populations, especially as we think about palliative care for children and youth. And there's just really limited resources around that in the state. A big piece of what we have also done this year was we have a needs assessment that we are required to do for Title V every 5 years. And so this, over the last year, we have been collecting that data. So we used our council to get ideas of what data sources were readily available, who were some of those key partners we needed to talk to. One of the things I wanted to be very strategic about this go round was making sure that we weren't just talking with those people that we traditionally partner with or who traditionally receive our funding. Who are some of those folks that maybe don't receive funding from KDHE or who we haven't worked with in a while, and how could we better connect with them, and what are the needs they're seeing that maybe we're not seeing, or because there's not that partnership there. We also shared with them the results of our site review from our block grant application. And then we also like to use the time to provide a legislative update. So every year trying to share kind of the things that have happened in the legislature that impact children and the maternal and child health population. And again, we really seek to have that diverse membership so that in every meeting, we're not just focused on just that maternal health aspect or just child health, but really making sure that every meeting has something that is for everyone, regardless of maybe what niche that they happen to be working in. Next slide. Excuse me. One of the other things we've really been intentional about this last year is making sure that we have data to share with folks. We really want to be as transparent as possible to show where we're getting the findings that we have and why we're thinking of engaging in the work that we are, so that we're all really operating from a level playing field. And then each meeting also includes some small group work, and these are based on our Title V population domain. So there's a women maternal group, a perinatal infant group, child, and then also adolescent. And this year we've asked them to start to work on a small project. We provided a little bit of funding for that to work on something that would advance the Title V state action plan. And so one of the things that has occurred with that is in our perinatal infant group, with our newborn screening program, we have a follow-up that if a child does screen positive for something, we are good about following up with them. But for those that don't, there hasn't been that connection of sharing resources. So our newborn screening director and team have worked to build onto their webpage a welcoming baby web page where anyone who has a child, regardless of if they screen positive or not, is provided information on the resources that are available to them in helping them raise their child. So we're really excited about that. And then next slide, please. So over the course of the next year, we're going to continue working on those special projects and getting those completed. Another major piece will be that our Title V needs assessment drives our state action plan. And so we will turn that in with our application in July. So we are going to use one of the meetings this year to have them review that, provide a little bit of the results of that needs assessment, as well as what our thoughts are around that plan and how we intend to measure it, so that we can ensure that what the community said and how we're planning to address those concerns really are in alignment. Also, we have an executive team that is going to be reviewing the bylaws. We've had some transition at KDHE in the maternal and child health program. And so in that, I think we all feel that we as KDHE have kind of started to play too large of a role in driving some of the work of the Maternal and Child Health Council. And we really want to give that back to our partners that are on that executive team so that we're really allowing them to be the ones that help provide those recommendations, not only to us, but also to Secretary Stanek. And then lastly, we are continuing to try and diversify our membership and engage more partners in the work. particularly around those that are in the childhood and adolescent spaces. So if you do know folks that would be interested in participating on that council, please feel free to have them reach out to me. And I will be happy to take any questions at this time.
Thank you, Jennifer. Does anybody have any questions at all? Okay, if none, again, there's her contact information if anybody would like to reach out to her in the future. Next, we will hear from Allie Braun, who is going to give an update on the Family Advisory Council.
Hi, everyone. Happy to be here today. If you're not familiar with the Family Advisory Council, the Bureau of Family Health's Family Advisory Council, also known as the FAC, consists of families across Kansas who help provide guidance to KDHE on how to best support mothers, infants, and children, and also children and youth with special health care needs. Our council currently has 28 members, and we're looking to expand always. Can we go to the next slide, please? So our council has 5 core work groups that you'll see here. The women, maternal, early childhood, child and adolescent, and then we also have children with special health care needs. And we'll go to our next slide. The FAC meets 4 times a year. 3 of those meetings are virtual with 1 in person. The in-person this year happens to be in Manhattan, and that will be in April. We try to do different areas based off of where all of our FAC members to make it easiest for them to be able to attend, because we do know they have busy lives. So our council meetings look like we have, there's time for whole group discussion where we usually have somebody from an outside presenter and inside presenter from KDHE. We usually pick a partner organization or an organization that has services for families that they may not be familiar with. So then they also have their small group discussion where we break out into those work groups that I talked about previously, and they work on special projects that align with our Title V State Action Plan. And the next slide. And a little bit about what's happening with the FAC right now. The child group and adolescent group have paired up to present at the Parent Leadership Conference back in September of 2024. And their presentation was on parent feedback. There was great discussion with the participants around services that are lacking in their areas when it comes to mental health for either their children or for themselves as well, and just kind of how they can move forward with that. So they will be continuing to dive into that data and kind of see where they want to pinpoint their discussions with people who they think are important to include in this. And then our children with special health care needs group in our early childhood group is working with 1-800-CHILDREN this year to go through their resources, really dive in to see where is there a lack of connection happening? Is there all the resources that there is for children with special health care needs listed there? There had been comments that it's been kind of hard to find. And so working through those kinks and seeing if we can get it more successful for families to be able to find those resources easily as a one-stop shop and instead of having to dive into other places to look for that information. And the next slide. After reviewing the current members of the representation this year of our FAC, we noticed there's a lack of members with children under the age of 5. So we really want to increase that to make sure we have their input in what we do as well. So to address this, we plan to attend community baby showers to help and invite those new members to join, or mothers to join the FAC to help to get that word out there as well. And then we also plan to expand our FAC work groups to include a fatherhood work group / non-birthing partners. We see that fathers do have a very valuable input, and they are also a part of the families most of the time. So to include them just makes a lot of sense to us here. And so we hope to increase that and work with different fatherhood groups to get that those numbers up there for them. And then as funding is available, we would like to send more FAC members to present at conferences and be able to be more involved in that, as we had a great turnout when they presented at the Parent Leadership Conference this year. And that is all I have. I would be happy to answer any questions at this time.
Hallie, this is Maritas. I do have a question.
Yes, of course.
So if there is another parent group that would like to invite a FAC member, who do we need to contact, or do they do that?
Yeah, you can go ahead and contact me. My contact information is listed on the next slide, I believe. So feel free to reach out to me that way and I can get you in contact.
Thank you.
Any other questions? If none, thank you, Ali, for that update.
Thank you for your time.
The last presentation before we take a quick break, we will hear from Holly Fry and Lisa Williams, who will give an update on the state home visiting leadership group.
Thank you. Good morning. My name is Lisa Williams, and I am with the State Department of Education, and I'm the program coordinator for the Parents as Teachers program, which is an evidence-based home visiting program in the state. And my colleague Holly Fry and I'll let Holly introduce herself here in a moment, but Holly is with the Department of Health and Environment, and we co-facilitate the state home visiting leadership team. And so if you'll go to the next slide, just to give you some overview, our purpose for the state home visiting leadership team is to look at policy, understand policy, and standards, look at our whole infrastructure and system for home visiting in Kansas, and then make any recommendations or changes to that to make entering the home visiting arena in Kansas as easy and seamless as possible for Kansas families and children. So the next slide will tell you a little bit about our group. We did last year, I think we announced that we did a little bit of restructuring to kind of hone in on some of the major home visiting programs in the state. And so our group consists of Holly and I, which represent KDHE and KSDE parents as teachers. And then we also have representation from the Kansas Children's Service League, which offers the home visiting program of Healthy Families America. We have the Department for Children and Families, which you heard earlier about the Families First programs that they offer, and they also are involved with the Early Head Start at the state level. We have two associations. We have the Kansas Head Start Association representative and also the Kansas Parents as Teachers Association. And then also our representation from the KU Center for Public Partnership and Research. So that's our team. If you'll go to the next slide. We want to tell you a little bit about some things that we did over the past year, and then I will turn it over to Holly after I talk about what we've done in the past year, and she's going to tell you what our upcoming plans are. So this past year, we hosted an annual Kansas Virtual Home Visiting Conference. We did this over the course of a day, and we had about 300 registrations for participation in that virtual conference. So we were really excited about that. That included not only parent educators, but supervisors of programs across the state and anybody interested in home visiting. And we had topics that really were a wide range of topics, from technical things such as safe sleep, behavioral health, substance substance abuse and addiction, things like that, and how they impact the families, to really focusing on our parent educators and the folks that are in the homes, the workforce, looking at retention, safety, and different supports that they could engage in to just help with their overall well-being. We also had some really fun topics and sessions related to the importance of play and how really teaching our families the importance of play in early childhood and development. So it was a great conference, and we're looking forward to another one this year that Holly will tell you a little bit about that. I mentioned we did restructure our membership this year, and that has helped us take a look at our group and how we do our work in relationship to the overall All In for Kansas Kids strategic plan. And so we've been able to really focus on some priority areas this year to support the state strategic plan. Our priority areas, just so that you know, we are going to and do focus on statewide availability of home visiting services. The second priority is the workforce, including recruitment, retention, well-being, advocacy, specifically focusing on helping people in the state understand what home visiting is and how it is an integral part of the early childhood education system, and is really a springboard for families and children to begin their educational journey. So just helping people understand that. So that priority we're calling advocacy. And the fourth priority that we have that we focus on is family capacity. And that, it just in a nutshell, is we want to look at referrals and do how many of our referrals that we get actually result in family engagement in one of the home visiting programs that are available in the state. So those are some things that we're working on. We have, oops, let's see. Oh, and then the last thing I wanted to mention just before we go on is that we also have been looking at the home visiting team representation in all of these other wonderful groups that are going on around the state related to early childhood initiatives and how we can integrate into those existing groups and really have a plan for representation and information sharing. Holly, can I turn it over to you, my colleague, to talk about our upcoming events?
Thank you. So as Lisa said, I'm Holly Fry with Kansas Department of Health and Environment. I'm a home visiting program consultant there, and we fund universal home visiting programs as well as some evidence-based programs across the state. And Lisa and I co-lead the SHIVL, for short, State Home Visiting Leadership Group. And so building on our priorities and our conference that we've done in the past, we have some upcoming things that we are planning. And the first thing is to host the 2025 Kansas Home Visiting Conference in person this year and across 5 different regions in the state, which is different from the last few years where it was fully virtual. And so we're going to convene home visitors from the various models across the state and have an emphasis on the home visiting and early childhood network and what connections or systems can be put in place to strengthen that and help families connect at any place and move through the continuum seamlessly. And so we are excited about that change. We're also developing an action plan to achieve those 4 priorities that Lisa shared, so that we can kind of move from the high level goal to how are we going to get there. And she also mentioned we're going to continue looking at and ensuring home visiting representation is in early childhood systems conversations. So like this meeting here, it's really great that the 2 of us are here as well as the other members of the State Home Visiting Leadership Group. And then we're going to coordinate efforts for Kansas Home Visiting Programs Day at the Capitol on March 5th. And I want to invite everybody on the call here to join us that day at the Capitol to share what home visiting is, the impact that it has in the state. I have to shout out our Kansas Parents as Teachers Association and Kansas Head Start Association, Shivel members, Hillary Cohn and Heather Schrottberger, because they are leading this effort, but our group will be there to elevate home visiting that day. So join us if you can. And then we are also reviewing kansashomevisiting.org to make sure that the content is up to date and reflects the full continuum of home visiting services available in Kansas and includes connections to other pieces of the early childhood landscape in the state. Next slide. Thank you. So are there questions for Lisa and myself? Thank you.
Thank you, everybody.
All right, so thank you both for your presentation, for your updates. We are going to take a 10-minute break. So we will return at 10:45. So go on ahead and stretch, grab some coffee, and we will see you back again at 10:45. Hello, everyone, and welcome back from your break. I hope you had an opportunity to stretch and get some coffee, catch up on emails, etc. So we are going to hear from our next presenter, and that is Natalie McLean. She'll be giving an update on the Kansas Early Learning Standards.
Good morning, everyone. I'm Natalie McLean with Kansas State Department of Education. I'm the preschool programs coordinator. I am a co-lead along with Kimberly Kennedy on the Kansas Early Learning Standards work group. We're the next slide, please. Thanks. So our Kansas Early Learning Standards recently have gone through an update. Our team really wanted to just kind of look through the standards, update anything that needed updating, but really work on simplifying and making the standards really easy to use. So our Kansas Early Learning Standards, or KELS as we like to call them, are the standards. They're a guide to what we really want young children to know and be able to do. So our Early Learning Standards team is comprised of early childhood partners from across the state, with representatives from all aspects of Kansas early childhood care and education workforce. So we had representatives from childcare, from preschool, from Head Start, from our 2- and 4-year colleges, all kinds of different input as we updated these standards. So over the past year, we've really concentrated on, now that we've got them updated, we've got them out. So we've created a website to house these updated standards. I want to draw attention to the website, which is kels.ksde.gov. This was recently changed to gov. If it was previously .org, if you go to .org, it'll still take you where you need to go, but .gov is the correct one now. If you go to this website, you will find those updated standards. You can access them digitally, both in English and Spanish, as well as order printed copies if you'd like to order printed copies. The site also offers training, including some short videos and access to the full KELS course that our Kansas Child Care Training Opportunities partners has developed and offers, along with other resources to help those who are working with our young children to incorporate the KELS into their practices. So distribution of our printed copies did occur this year. We had initially 12,390 copies sent out to licensed family child care homes, centers, preschools, school-age programs, infant toddler Part C providers, school district staff, cooperatives, interlocals, and Head Start programs. So they went out widely across the state. Since then, we have put that option to order printed copies on our website, and 134 Spanish copies and 564 English copies have been shipped. Those continue to come in. I had like 15 that I sent out this morning, so we continue to get requests for those printed copies, and we continue to ship those out. Next page. So as we move forward, we will continue to work on getting those distributed printed copies out. Like I said, we have them both in English and Spanish, and you can order those on our kels.ksde.gov website. We also continue to develop training and resources. If you go to kels.ksd.gov, you'll find a tab at the top that lists resources. Under that, you will find several different tools, along with some alignments and crosswalks with different curricula and different, like we have a crosswalk with the Head Start early learning framework. So some really cool tools for people to use as they work with the CALs. We continue to develop new resources as other curricula across that we know are used across the state. Send us those crosswalks. We'll keep putting those up. I know those can be really helpful when you are working on choosing new curriculum. We are also working on developing a tool to help people crosswalk what they have already with the early learning standards, just to kind of see where gaps may be. Another effort that we're working on is just getting that cals.ksde.gov website out there so people know where to find things, and just keep adding resources. Here's my contact information if anyone has any questions. If you have a request for a resource that you think would be helpful, please do feel free to reach out, and that's something that we can take to the group and possibly work on. Let me know if you have any questions.
If none. Thank you, Natalie, for the update. And I love the bound copies of the CALs, and so actually it looks visibly. Actually, you did a really nice job in the layout of it. So it actually good job to everyone that worked hard on this.
We had an awesome team.
Yep. Next, we will hear from Kara Unger and Ali Braun, who are going to give a update on the family leadership team.
Hi, good morning. Thank you. My name is Cora Unger. I am the Title V SHIN Director for KDHE and the state of Kansas. And then Ali presented earlier, so I don't know if she wants to pop on and introduce herself really fast, or she'll just do so when I hand it over to her.
I can go really quick. I'm Ali Braun. I'm the Family Systems Consultant at KDHE.
Thank you. So for a really quick overview on the family leadership team, it was established in 2021 as part of the preschool development grant in that first round that Kansas was awarded, and the All In for Kansas Kids strategic plan. It was built with the recognition that family voices are essential and that meaningful partnership with families creates stronger and more effective programs. The FLT is dedicated to the following goals, which include informing, supporting, and advising on issues that impact families, developing initiatives that engage families in systems level change, promoting collaboration between families, community services, and state agencies, and then as well as strengthening coordination with early childhood care and education, ECCE system at both the state and community levels. So we can go on to the next slide. The guiding principles for the FLT were developed in partnership with families and program leaders, and is driven by the core beliefs. And some of these will probably sound familiar from previous presentations when it comes to working with families. So I'm glad we're all on the same page. But that family engagement is foundational to understanding the real experiences of those served by state and community programs, involving families in program planning, design, and implementation, as well as evaluation, ensures that services truly meet their needs. Which if we're not having our families meet their needs, there's really, it's a lot of work for no real purpose. Strong family engagement fosters healthy development and overall well-being for children, youth, and families in Kansas. Empowering families helps prevent child abuse, supports school readiness, promotes economic success, and strengthens parenting skills. We also want to look at a multi-generational, strength-based, and family-centered approach that is the most effective way to support families. And also to note that family looks different for everyone, and it's important to include diverse family representation on the FLT to bolster family voice for all families across the state. Next slide. So another key for success is to build a collaborative and inclusive team. So the goal is to create a diverse, dynamic family leadership team, bringing together family members who are strong advocates for their families and their communities, as well as state agency leaders and program staff who provide services to families, particularly in early childhood. And by working together, agencies and program staff recognize the importance of family engagement and actively support evaluating or elevating family voice and to drive positive, lasting change throughout Kansas. Our next slide. All right, so to talk about our accomplishments that we have done over the past year and then our future plans, I will hand it over to Allie.
All right, so at the start of 2024, there was announced that there was a series of family and caregiver roundtable sessions, which quickly evolved into the parent-provider fireside chats that were held every month throughout the year. This session provided a valuable platform so that parents and caregivers can get direct access for information about the state-level programs and services. While they engaged in meaningful discussions with the knowledgeable providers. There's great discussions on asking questions and getting feedback with those different organizations. And some of the topics that were covered were 1-800-CHILDREN, ASQ screenings, resources for children ages 5 through 8, home visiting, prenatal to postpartum resources, and in-person discussions on family resources. So key highlights and takeaways from the events were shared on the All In for Kansas Kids website, and ensuring that families across the state could all benefit from these insights and resources provided. Next slide, please. So our goals for 2025, with the addition of myself now as the family systems consultant, we are committed to enhancing and collaborating engagement with families this year. We will host 4 additional fireside chats focusing on topics that parents have identified as important. We will either get this through our MCHC programs needs assessment or the FAC members or other family-facing groups. If any of you has any ideas today of pressing matters that you would like families to talk about, please let me know. Our contact information is on that last slide. And additionally, the family leadership team will prioritize a key need expressed through both families and providers across the state. And this is to bring a specialized leadership training to Kansas. This initiative aims to empower individuals to become stronger families leaders within their communities. So looking forward to that. With most of 2025, we'll focus on exploration and learning. We are excited about the possibilities in the future. So stay tuned as we update as we move forward. And that is all. We are happy to answer any questions that you all have at this time.
If no questions, thank you, Cora and Allie, for the update. Cora, I think that you're absolutely right. When you hear the messages and we're all kind of saying the same things, that's kind of comforting, right? Because we're all on the same page. We're all seeing the challenges, the solutions, and working together. And so I think that that's great. So thank you again for your presentation. Next, we'll hear from Kathy K.O. And so I like that she goes by that. And she is going to give an update on the Kansas State Interagency Coordinating Council.
Yes, hello. And more people know me actually as Kathy K.O. than when I say Kathy Kirstenbrock Osmeyer. So I go by KKO and Kathy K.O. often. And I am the chair of the State Interagency Coordinating Council, also called the SICC, and then also referred to as the Coordinating Council on Early Childhood Developmental Services. The council's mission is to ensure that a comprehensive service delivery system of integrated services is available in Kansas to all children with or at risk of developmental delays or disabilities from birth through age 5 and their families. The state ICC is established in both federal and state regulations We also have a sister organization in the Special Ed Advisory Council, which is established in similar laws, and it is housed through the Kansas State Department of Education, and their members are appointed by the state board. But this council really focuses on 3 to school age, where they're 3 to 21, but there's a little overlap in there. Again, it's funded, our council, through the Department of Children and Families, the Kansas State Department of Education, and the Kansas Department of Health and Environment. And the service programs that we work with are the Part C Infant Toddler Services, which focus on home visiting, and then the Part B 619 Special Education Services that are 3 then till kindergarten. Now, the Part C, sometimes people are still a little confused, used to be called Tiny K. A lot of people knew it as that, but there was a name change earlier and we go by Infant Toddler Services now. The state ICC supports 29 infant toddler programs across the state of Kansas, and all of those infant toddler programs have their own local interagency coordinating councils. So we support those local councils as well. Those councils are also funded with grants through the Kansas Early Childhood Developmental Services at KDHE. The council is made up and is determined by law to include partners representing health and environment, the governor's office, Division of Children and Families, insurance, 2 members from the legislature, 1 from the House, 1 from the Senate, and then they would be from different parties, the Board of Regents, the Kansas Health Policy Authority, and then 8 to 17 members appointed to 3-year terms by the governor's office. And those appointments include parents of children who receive services or are at risk of having developmental disabilities. Parents are real important to this council. Then provider members, those that serve this population, and general public members. The local ICCs are also supported with the council in that there's technical assistance and information about bylaws that are included on our webpage. And then also there are grants available, and the grants then are targeted to help with family involvement and community awareness. And last year there was $33,931 sent out to different councils across the state. And this year it looks like we're on track to even grant more money to the councils across the state. The council works to discuss pertinent matters pertaining to our youngest Kansans, including legislative updates that may require our attention, new programs that our agency members may be working on, and work on committees and task force on some targeted areas that we develop through strategic planning each year at the beginning of the year. And of course, the committees match up with our goals. And that'll be on the next slide, I believe. Okay, another slide. I'm moving faster than you are, sorry. Okay, there we go. So the committees that we have include the executive committee, which is the chair, the vice chair, which is Lisa Collette, and then Stacy Clark, who is an early childhood coordinator at KSDE. She also serves as the secretary and keeps us all organized on our council. And then Tricia Wagner, who is the state coordinator with the Kansas Early Childhood Developmental Services at KDHE. And then we have 5 goals. And again, the committees work on these goals. And goal 1 is Medicaid, to really review and utilize existing Medicaid research and data to maximize funding for infant toddler services. Goal 2 is to focus on categorical aid, making sure that all of our infant toddler networks and our school-based 619 programs are utilizing the program and maximizing those reimbursements. And goal 3 is inclusion. And of course, when we talk about inclusion, we're really focusing on students and children with special needs being involved in environments that are least restrictive. their natural environments, or where they would be if they didn't have any disabling conditions to age 3. And then, of course, least restrictive environments for 3 to kindergarten. And so we really want to see services done in a way that would be most inclusive. So for especially the 3 to kindergarten programs, we don't want to see a lot of pull-out services by PTs and OTs and speech pathologists. We really want those done within the preschool environments that children may be in. And of course, we really want to work on home visiting programs when we're working from birth to age 3. The fourth goal is then to promote management and functions of the state ICC as it aligns and complements the All In for Kansas Kids strategic plan and prioritizing the centralized, reliable resources and information for parents to increase mental health resources for both providers and caregivers, and to collaborate to improve local workforce recruitment and retention. And goal 5 is then again to support those local interagency coordinating councils to maximize their role in serving children in their communities. And we offer professional learning every fall in a retreat. And this has been really popular. And I don't remember exactly how many people participated this year, but it seemed like there was even more than last year. And so again, you can reach us at a website that's on the next page, and you could contact me, or if you go to this website, again, it's monitored by Stacy Clark, and we'll get back to you with any questions you have. And of course, I'll entertain any questions that we might have today. And it is a quiet group with questions today, I've noticed.
That it is. If no questions, Kathy, thank you for the update. Next, we will hear from Jared Barton, who is going to give an update on the Kansas Early Childhood Data Trust Governance Board.
Good morning, everyone. I'm Jared with the University of Kansas Center for Public Partnerships and Research. I serve as CPPR's lead point directing our role with the Kansas Early Childhood Data Trust and have several updates for you today. Next slide, please. For some quick background context or reorientation to the Data Trust for those of you that have been less involved, it's an initiative that started in 2021 as a part of All In for Kansas Kids that demonstrates 5 state agencies' commitment to sharing and using data to improve programs and services for children and families in Kansas. While it's common for state agencies to partner and seek to use the best information to support decisions, having it be kind of like cross-organizational and having a larger infrastructure for it does require legal, technical, and kind of a governance infrastructure to make data-informed decisions possible. And that's ultimately what the commitment of the Kansas Early Childhood Data Trust is. Next slide. The Data Trust members collaborate on what we refer to as authorized projects. And an authorized project is when 2 or more state agencies determine that it's necessary and important to share data or integrate data with each other. So for example, one of our projects integrates early childhood services data from the Children's Cabinet with child welfare data from the Department of Children and Families. And we integrate those data to answer or evaluate important questions. And so when 2 or more agencies seek to have that kind of collaboration and partnership, that's what rises to the level of an authorized projects. Authorized projects undergo a form of data sharing agreements for any data that are shared, matched, or analyzed. And findings of any authorized project are shared, presented, and disseminated through the Data Trust governance structure. Currently, there are 3 authorized projects which involve the integration and utilization of multiple state agencies' data and information, and we'll be reviewing the updates and current findings of those in the next few slides. First, as I mentioned, there is an intentional infrastructure and several frameworks guiding the Data Trust that comprise really kind of 3 high-level parts. First, there's a legal and ethical framework where the Data Trust was formed and an agreement put in place that multiple agencies agreed to in 2021, as well as for each one of these projects, these authorized projects that emerge, a project-specific data sharing agreement, which would be between the agencies that would actually be sharing the data. Second, there are technical resources and assets that support data integration, analysis, and interpretation of integrated data. So the data coming from the organizations, data dictionaries, staff, and data managers and IT staff, and administrators that help with interpretation and understanding of the data. Those are necessary components of the governance and data trust model that we have in Kansas. And then finally, a data governance board that meets quarterly, that includes representatives from all 5 of the state agencies that are a part of the data trust and seeking out opportunities to partner together to integrate data. At CPPR, we are not a member of the governance board, but we are a technical trustee. So kind of our role is to support the governance board's decisions and support them in their kind of pursuits of these authorized projects. To date, there have been 3 authorized projects with findings and activities, and we'll review the progress of what's been accomplished with those now. Authorized Project 1 is an agreement between the Department of Children and Families and the Kansas Children's Cabinet and Trust Fund, and it really is intended to share data to investigate whether participation in early childhood services is associated with reductions in the rates or numbers of children being removed to out-of-home placements or children being removed to foster care. So, in the hope that providing services in early childhood could serve as a protective factor against unnecessary removals. This project is longitudinal. It's been ongoing since 2021 as the first project of the Data Trust. And as of the latest analysis, in 2024, there are some promising findings that have emerged from that. So you can see those there in the bullets on the screen. Participation in early childhood services is associated with a 28% less likelihood or reduction in removals to foster care. 96% of children participating in early childhood services were not removed to foster care out-of-home placements between 2015 and 2024. So a long period of time, and looking at just the volume of children served with early childhood and finding it promising that the majority of them are not removed to out-of-home placements. And then finally, 384 children from birth to age 8 would have likely been removed to foster care between 2015 and 2024 had they not been exposed to some kind of early childhood interventions and services. So some promising findings that have emerged from that authorized project. Second authorized project is the public-facing dashboard that is intended to kind of count the number of children that across Kansas and in different counties and areas of Kansas that may be receiving some form of early childhood services. This has been a very large-scale effort that's involved lots of collaborations and partnerships with all of the state agencies, as well as different program managers and directors within those state agencies that are overseeing a variety of early childhood initiatives or services to children and families that would impact kids in early childhood and their families. It first launched, the dashboard is public and live, first launched in December 2023 with its first round of data. It's now being updated with another year's data. So soon the 2024 data will be launched, as well as some new features that are a part of the dashboard. So even though it started with 1 year's worth of data, the intent and the idea is that it would become a longitudinal system itself, where every year it could be updated, and then we would have kind of historical information about counts of children served. In the next launch, update to the data, we'll see that additional information for 2024, as well as some new features that kind of overlay population level data that we get from the census, which will give folks an understanding of maybe the proportions, the potential gaps or holes of the children's age, the population of kids in early childhood versus maybe the numbers of kids in those areas that have actually been served with those services. So some additional information to help with planning and assessing need in communities. The third authorized project, the newest authorized project, began late in the spring of 2024, and it involves, this is a pilot project to link records between early childhood data from the Kansas Children's Cabinet and Trust Fund with possible student data that would be in the Kansas State Department of Education's data system. Early results of this matching effort appear to be promising to meet some of KSDE's what they're exploring as part of the state's longitudinal data system development. And how they would implement that, and having the information necessary in order to see if we can identify likely cases that would match in early childhood data sets and data sets that we might start receiving once kids reach the school age and enter the school system. This could support future pathways for early identification of impact of early childhood services on student outcomes, and also student needs once they reach school. So promising matching results there, and what will kind of propel us into the future directions of this next. Well, moving ahead in 2025, the Data Trust is going to be working really closely with the Kansas State Department of Education members, who are really key and play a critical role in future longitudinal data system efforts in Kansas, and the potential for integration of data in Kansas. The promise of that third authorized project and the accomplishments of the first two projects have really provided that foundation for continued collaboration and kind of a will to continue exploring what's possible and what could be tangible benefits to Kansas as a result of having these kinds of integrated and longitudinal data systems in the state. And as I mentioned earlier, we're always seeking additional enhancements to the existing tools and structures and pieces that have been put out there. So continuing to just build, improve, and enhance it to make data the most understandable and useful possible for future impact. And if there's any questions, I can take those now.
Okay, so if no questions, Jared, thank you very much for the update. Next, we will have an update from Sarah Minshall, who will talk about the Quality Recognition and Improvement System Advisory Board.
Great. Thank you so much. It's good to see you all, and good afternoon now, I believe. We've kind of broached into the next time of the day. So thank you for the opportunity to share, and we will go ahead. Yep. Thank you. So at Child Care of Kansas, we are the contracted agency responsible for implementing the statewide Quality Recognition and Improvement System, the QRIS. Through this work, we provide the structure, support, and resources needed to help child care providers enhance quality and achieve meaningful improvements. By collaborating with state agencies, community partners, and child care providers, we are building a comprehensive provider-focused system. And you can see here on this slide some of the offerings and ways that Child Care of Kansas really does that in multiple modes. So next slide. We are funded by the Department of Children and Families to accomplish this work. And you can see here several different categories in which the advisory board was really helpful and impactful as we moved through the last year. And we have had the opportunity to work with the advisory board to share and disseminate some of this information out into the communities, to gather feedback, to look for potential partnerships to continue to grow and expand services. So shared services is a piece of the work that we are accomplishing. And we have been able to utilize our advisory board to really identify some of the needs in the community, as well as share and discuss the information that is already going on, so that we can make sure that we are working together and really avoiding duplication of efforts. let's see here, the child care management software growth. So that was actually a decision that the advisory board worked very closely on, was identifying the child care management software that we would offer and implement as a state through this project. And now you can see we have nearly 1,000 providers that are utilizing that offering. So the advisory board was integral in viewing some of the demonstrations and providing feedback around what options would be most helpful for providers. And then the launch of Links to Quality. So Links to Quality is the Kansas Quality Recognition Improvement System. And we are launched, so that is exciting to announce. And we are using our advisory group to help us navigate development of Links to Quality, and really looking at how we can grow and implement new strategies. Links to Quality works with programs to build upon their strengths by linking the standard of quality competencies. And it really helps providers establish a higher quality standard in their care. Each link contains quality indicators specific to the designated content area and best practices for childcare programs. Right now, the group is actively engaged in link development for Links to Quality. They 2 weeks ago, I believe, received a draft version of the Program Administration 2 link. So that was pretty exciting to see how we can work together and build upon links that have already been established. Members have the opportunity to participate in subgroups where they are able to shape the links being developed. Once they participate in those subgroups and provide feedback and expertise from their own lenses and areas of work, we work together to review and provide feedback to ensure that the links are practical, valuable, and reflective of provider needs. Before the links move to the formal review process with our partners at DCF. Next slide. So you can see here, looking ahead, we have a few areas that we are really excited to tap the expertise of this group and work together to expand our efforts. We are going to continue the work on links and make sure that Links to Quality is launching statewide in a way that is helpful to childcare providers and in a way that is getting out there and really helping increase that quality for Kansas children. We are also going to work together as an advisory board to determine how we can establish and ensure the longevity of shared services. So working together to identify potential upcoming funding opportunities, partnerships, community efforts to really ensure that there are not gaps for providers and they can receive those really integral services that help them execute their business and quality care. Next slide. So that is my contact information, and please reach out if you would like to be a part of the group. We would love to have you join us. We're always encouraging folks to join, even if you want to listen in and join and just kind of see what's happening with the work. We would invite you to be a part of that conversation and meeting with us, and we look forward to hearing from you. So thanks again for the opportunity today.
Thank you, Sarah. Does anybody have any questions?
I have a quick question. No, I'm sorry.
Yes.
I was trying.
Fine.
With the links to quality, is this different from being in the program, or is this how to help improve the program? Because I'm a provider and I am in the program for links to quality, and I meet with Katrina every other month. So, but are you saying this is different from the actual program?
Yes, so the great question. The advisory group helps sort of inform and shape some of the work that is taking place within the actual program that you're participating in. And we would love to have provider voices as a part of our board and, really working to make sure that we're aligning. So if you're interested in joining the advisory group or have time, I know I'm sure you're very busy, but we would welcome that opportunity. And the advisory board is the group that really on the back end is doing some of the work behind the scenes, so that then when you are moving through as a provider and working through your links, they are hopefully helpful and well-rounded and providing good opportunity for you.
Yes, it goes there. Thank you so much.
Yes.
Great. Any other questions? All right. Thank you again, Sarah. For our last presenter, we will have Nanette Perrin, who will give an update on the Governor's Behavioral Health Services Planning Council's Children's Subcommittee.
That's a mouthful, isn't it? Thank you guys so
It
much.
is.
Thank you so much for the opportunity, and I will try to go quickly because I know I am between you guys and either your next meeting or maybe even lunch. So, I really appreciate the opportunity to share a little bit about our children's subcommittee. And we do report up to the Governor's Behavioral Health Services Planning Council. And really what we do is look at across the state, what are the behavioral health needs of the Kansas citizens? And are there things within our system that we can either improve or get more information out there about? So we are always looking for new recommendations. We're also always open to new participants as well. Next slide. So I went ahead and summarized our goals. I won't read each of them to you, but as you can see, one of our goals is supporting the KS Kids Map program, and that's a link to just additional information in their report. But one of the things that we really look at is, how to make sure that there is access to supports for those individuals who are underserved in rural areas, all of that. Next slide, please. A second goal was really looking at that specialized population. One of the gaps that members of our groups, had brought up are those individuals, especially those in the intellectual and developmental disability population. And really, what does that transition look like for them? Either that transition out of school, things like that. Next slide. So here's kind of the progress on that. One of the things is the state is looking at a community support waiver to be able to support more individuals, because for those of you that do not know, the individuals with IDD are often on what's historically has been a 10-year wait list. So the community support waiver was mentioned before. The other thing is for individuals in DCF, this last year there was the exciting start of legislative support for SOUL, which is to look at those permanency options. I'm not going to read you guys all of my bullets because that would take you too long. So, but they're on the slides, and I'm always happy to answer questions or talk with you guys after as well. Next slide. So our third goal is really those mental health services and looking at, how we can make sure that we're focusing on prevention. I know that there was a maternity presentation much earlier. One of the things that we often talk about is, postpartum or even, that perinatal support that families may need. So, really looking at, is there a way that we can make sure that we're all working together? We also collaborate a lot with the 0 to 3 committee. If you look at the 0 to 5, there is talk of diagnostic criteria 0 to 5 and how that could potentially be implemented in Kansas and better improve those mental health services, specifically for those tinies. So next slide. So here are kind of the growth opportunities that we're looking at is, the community support waiver is being developed by KDADS. There are many opportunities to follow along and or participate in that. Many of our subcommittee members do that, but that's also open for all of you. Looking at the specialty psychiatric residential treatment facilities, one of the things that has also been discussed in our committee is really those individuals that may qualify for a higher level of behavioral health support, but we do not have any providers in our state that are willing to treat those individuals with either complex medical or maybe really high acuity behavioral needs. continuing to support KS Kids Map as that moves forward, and then looking at again those that diagnostic criteria 0 to 5 and looking at if there are opportunities for that to go. We are looking at the oversight of some of the postpartum work just to make sure that information is getting out in regards to that perinatal and the additional support for individuals in that first year of life. Next slide. That is my contact information. If you are interested in joining, or if you just have additional questions, you can always outreach me. We do meet every 2 months on Friday mornings, the second Friday of the month, every other month. So our next meeting is in March, following one will be in May. But feel free to outreach if you have any questions. Thank you, guys.
Thank you, Nanette. Does anybody have any questions for Nanette? If none, I would like to thank everyone who gave presentations. We had 12 different presentations today, hearing about the amazing things that are happening across Kansas. Seems like we're a little busy around here. Is what it seems like. We have a lot going on, and so hats off, round of applause to everybody with the good work that you're doing. Panel members, before we, sign off, I'd like to give an opportunity for anyone to come off mute and share a bright spot or share information if you have any that you would like to share with the group.
This is Maritas. I shared this bright spots, I believe, multiple times, but I'd like to share it again. So our school, Kansas State School for the Blind, has a early childhood enrichment program, which is also a daycare and a preschool for 6 months to 6 years. It's inclusive, so every child is welcome.
Very good, thank you. Any other bright spots? Okay, if not, keep an eye out for the Early Childhood Governance Summit event summary, which will be on the Kansas Children's Cabinet's website. Please contact Lindsay with any follow-up questions or requests for additional information. If somebody mentioned something or you want more information about something or whatnot, Lindsay can certainly coordinate and get that information to you. Here are the links to all of our social media handles. Work groups will have the opportunity to, I believe, Lindsay, you said that you can leave the things open for work groups to meet should they like to. I know this is a little bit later in getting started, so some of you may have made other plans to meet at a different time, but the links will be open for you to be able to meet should you like to. So thank you again for your time today, for all of the presenters. Lots of amazing information was shared, and we thank you all for gathering the information that you did and for sharing the wonderful work that we're doing in the state of Kansas. So you guys take care. It looks like we have a heat wave coming soon, when you wake up and it says that it feels like temperature is 1 degree instead of -20, and you're happy about that, it lets you know that there's definitely we're definitely in a heat wave right now. And so enjoy the warm weather. Hopefully, old man winter is done and we can actually live in comfort again. So you guys take care, and we look forward to seeing you at next month's meeting. Have a good day.